Hello, my little chilly babies. Are you ready for the truth about PPIs and SIBO? All right, now that I'm done being weird, hello, welcome back. Today we're going to be talking about the association between PPIs, proton pump inhibitor drugs, and SIBO. Now, for those of you who don't know, some familiar names for PPIs would be things like Nexium, Omeprazole, Protonix, Prilosec. These are all drugs that are used for reflux or acid indigestion, and they suppress your stomach acid production. So the reasoning goes, okay, you have reflux, that means you have too much stomach acid, so let's tamp that down, and bada bing, bada boom. But the thing is that these drugs have a lot of unintended side effects and consequences that are coming into the limelight a little bit more, thank God. And one of them that has gotten more and more press in the last decade or so is the potential for PPI drugs to be a root cause for SIBO. And I know I've talked about this on this channel, I've talked about it in the IBS Freedom podcast, but I wanted to elaborate a little bit more on the research because I don't know about the rest of you, but I've been in the SIBO world for a while now, and I observed something kind of weird happen a few years ago, and I want to start telling you about this. There's just like the teensiest bit of conspiracy theory sprinkled in here too, so it's going to be a fun time. Let me go ahead and make myself a little head bubble. And the first thing that I want to show you is this website where I was able to pull up the top 200 drugs that were prescribed in 2020. And not surprisingly, we have Omeprazole being the number one PPI drug, and that's clocking in at number 8. So these are really, really, really commonly prescribed medications. I cannot emphasize enough. These are so commonly used and they have so many side effects and risks. And I really do strongly believe that SIBO is one of them. Now, if we zoom in on proton pump inhibitors as a class, same website, just looking at this, we could see Omeprazole makes up about 61% of the prescriptions. Pantoprazole makes up about 28% of those prescriptions. And then there's a couple others that come clocking in at much lower rates. But you can see that there are an awful lot of these prescriptions. The number 8 slot goes to Omeprazole, but then there's even more beyond that. So overall as a class, this would probably make it into the top 5. And what's curious, I think, is if you look at the trend over time, you can kind of see a little bit. Let me draw it for those of you who might not be able to see it super clearly. Let's see, I'm going to draw it with like this reddish kind of pinkish color. You could see that the number of prescriptions written was fairly steady until right about 2016, give or take. And you can see if we come up here, like if we look at Omeprazole in the blue, 67,000, 71,000, 71,000, 70,000, 858. So it dropped by about 10,000, or I'm sorry, 10 million. Very close there, right? Like I was only off by a factor of what, 4? Down to 58 million. And it's kind of hovered around the 50 something million prescriptions ever since then, as far as we can see on this chart. And I think that it'll be curious to keep this in mind as we go forward with the rest of the video. So I just want you to frame that right around, 2016, that was the end of the heyday for the PPIs. And then ever since then, the number of prescriptions has gone notably down. Like their profits have been cut by about 1/6 or 1/7, which is fairly big deal. Like that's like 15% of their profit. And when you're the number 8 prescription in the entire country for the entire year, that's a pretty good chunk of change. So that being said, let's see. I would like to show you some research studies, as you might have guessed, because I'm in this room instead of my other room. So first of all, I pulled up the 3 meta-analyses that have been done so far and one article where they looked at the meta-analyses. It is what it is. So this was the first one that I wanted to show you. This was from 2013. And one of the interesting things, I'm not going to read you the whole thing, that would be a pretty boring video. But I want to highlight just a couple of things. So there was 11 studies done at that time that met their inclusion criteria, and they looked at everything. And what was interesting is they said, subgroup analysis revealed an association between SIBO and PPI use in studies that used duodenal or jejunal aspirate culture to diagnose SIBO. But no relationship was found between SIBO and PPI use in studies that used glucose hydrogen breath test. So we have a bit of a discrepancy even this early on, back in 2012 or 2013, whatever I just said. So when SIBO is diagnosed by an aspirate culture and they suck the juice out of the small bowel, they were seeing that there was a significant increased risk. But when you were using breath testing to diagnose SIBO, there was not an association. Fascinating. Considering how garbage SIBO breath tests actually are and how they have a lot of false negatives and false positives, I'm not surprised to hear that. Next one up, we have another meta-analysis on the same topic from 2017. And this one likewise also did see a correlation. So they said, similarly, they said a statistically significant association was found. And they said somewhere here, let me highlight it. Well, I have it on my other note sheet, so maybe I won't highlight it on the screen like I did here. They basically said the same thing. They said subgroup analysis demonstrated an association between SIBO and PPI use in studies that employed small bowel aspirate culture and glucose hydrogen breath tests for the diagnosis of SIBO. So they went a little bit further and they said, yeah, there is an association when you use the aspirate culture. There was also a correlation with glucose breath testing. They did not say lactulose, so I don't know if they included any of those in the studies off the top of my head, but they said yes for both. So this was in 2017. Next up, this is not a meta-analysis, but it was kind of a weird study design, and I wanted to show it to you anyway because I thought that they had something interesting to say. So this, they said, we evaluated meta-analyses to determine the association. So it's like a meta-analysis of the meta-analysis, if that makes sense. It's kind of a unique study design. I went with it. Sure, let's get into it. They did say that it was that PPI use significantly increased the presence of streptococci and enterococci, which are risk factors for C. diff infection, and decreased Faecalibacterium, a commensal anti-inflammatory organism. Yeah, Faecalibacterium is a really big deal. It's one of your, if not the top butyrate producer you have in your entire gut, and that is a huge deal. So you end up getting more strep, more enterococcus, and less Faecalibacterium when you take PPIs. Those are all really huge shifts in the microbiome. Then, I don't see it here in the summary, but in the article itself, I pulled a quote that said that there was a study that they mentioned, and they demonstrated that suppression of gastric acid by PPIs resulted in a 1,000-fold increase in bacteria in the stomach. Ugh. Barf. Barf, right? Like, you have X amount of bacteria living in your stomach normally. You take a PPI and then you get 1,000 times that amount living in your stomach now because you made it a hospitable, friendly environment for them. Barf. So I don't know about small intestinal bacterial overgrowth, but sure as heck, stomach bacterial overgrowth with PPI use. I think that's a pretty significant takeaway. And then some of those might get into the small bowel, or they might just muck up stuff in the stomach. I mean, that's a pretty big deal. And then we come to this one. So now we're coming up to 2018, and this is about where I wanted to put in my little nod to conspiracy theories. And I'm not normally a big conspiracy theorist, but I'm going to throw this out there. My observation, I kind of got into the SIBO world and into the SIBO space right around like 2015, because I think I was pregnant with my daughter, or I might have just had my daughter. And when the first couple years that I was in the SIBO world and I was listening to all the webinars and the podcasts, I was reading about it and listening to the summits and doing all the things, I thought it was pretty clear at that point that PPI use was associated with SIBO. Like, everybody talked about it. Everybody was very certain about it. And then out of the blue, out of nowhere, there started to be a shift in the dialogue. And then there was a distinct tone of, no, PPIs do not cause SIBO. What are you, crazy? Like, keep taking your PPI, it's fine. And I thought it was really fishy and really suspicious when that started to shift. And my kind of loose perception is that the shift started to occur somewhere around like 2017, 2018. And that's right around when this paper came out. And if we go back to the proton pump inhibitors, remember, the end of the heyday for PPIs was 2016. And then the drug companies started losing an awful lot of money because not as many people were taking their PPI drugs. Don't you find it a little bit of a coinky-dink that 2 years later, we start seeing, we get a meta-analysis that says, nah, dude, not associated with SIBO. You're cool. Keep taking your PPI. You're good. Wink, wink. I don't know. I find that very fishy. Now let me see. Where was I? All right. And this one's not that exciting. I'm not gonna pull quotes and read anything to you, but I'll just say that they found that PPI use was not associated with SIBO, which I found very fascinating and, again, maybe a little bit fishy. I have not bothered to check the affiliations and the conflict of interest for these authors, but I just find that very peculiar. So that's all of the meta-analyses. Now I just want to show you a handful of individual studies that I think flesh this out a little bit more. So if you bear with me, we're going to nerd out a little bit. This one, for example, this was 2010. So this would predate the first meta-analysis I showed you. And they said SIBO was detected in 50% of patients using PPIs, 24.5% of patients with IBS, and 6% of healthy control subjects. Well, that's mighty fishy, right? Like that is a pretty stark contrast. 50% of people with PPIs versus 25% of people with IBS overall versus only 6% of healthy controls. And this was using glucose hydrogen breath test right here. So that is very curious. Also, they mentioned that high dose therapy with rifaximin eradicated the SIBO in about 90% of people who had SIBO. Now, again, like when they say eradicated, do they mean they checked on the person 2 weeks later, it was gone, and they were like, cool, you're cured now? Or did they follow up with these people later on? That I don't remember off the top of my head, but I wanted to share that one with you anyhow. Next, to continue spilling the tea, in my opinion, we have this article, and you'll notice a familiar name on the author list. We've got Dr. Mark Pimentel, who is a very prominent SIBO guy. I'm sure everyone on this video knows that name. And I'll just, kind of loosely throw this out there for part of the conspiracy theory part of the video. He does work for or gets funding from the company that makes rifaximin. So I say that because I take everything he says with a little grain of salt, that I think he's very knowledgeable and I still follow the guy, but he tends to be pretty heavy on yay rifaximin. And I wonder if that is, if that's part of why. Now, continuing on, so what they did cultures of duodenal aspirates that were performed in almost 1,000 patients. So that's quite a lot of people. What I want to point out here, and they did, if you jump down to conclusions, they said the association between IBS and SIBO was completely independent from PPI intake. This next part I thought was a little bit overstepping and bold, but that's just me. Although gastritis was protective against SIBO, that's fascinating. Results show that PPI intake cannot prime SIBO. Them's bold words, in my opinion. I don't know. Like, I don't feel comfortable saying something that definitive from a single study, even if it was pretty well designed and they studied 1,000 people. Like, I really don't know if I would be comfortable saying that. That is very bold and cocky, in my opinion. But what I want to draw your attention to here, and this is something to keep in mind with all SIBO research, is this is the most important part of this entire page right here. So they said SIBO was defined as equal to or more than 10 to the third power CFU per milliliter. The relevance of that is that the diagnostic criteria used to define overgrowth or SIBO in aspirate studies has changed. Back in the day, we were using levels of 10 to the fifth power. And for those of you who maybe forgot math classes from back in the day, so if you say 10 to the fifth power, that's equal to 10. And then you move the decimal 1, 2, 3, 4, 5 points, which means 10 to the 5th power is now 1 million. Versus 10 to the 3rd power is equal to 10, and then you move the decimal over 3 times. So that is equal to 10,000. So Pimentel's group here is using a much lower cutoff for defining what they consider to be overgrowth. Personally, I've read enough articles on this. I think that's a huge mistake. I think we should, pardon me, almost inhaled spit. I really think that we need to be using the 10 to the 5th cutoff, and even that was maybe a little bit dicey and maybe was overdiagnosing some people. But Pimentel's research, at least from this one onward, has been using 10 to the 3rd CFU per ml. I think this is wildly overdiagnosing SIBO, and it's going to throw off a lot of their data. So the fact that they said PPI use was not associated with SIBO, I really don't think that this has much to stand on, because they're using a ridiculously low cutoff point for determining what they determine to be SIBO. So I really don't know how much I could put my weight in this particular paper. I think that's problematic. So that is one that I wanted to share. Again, this is 2016. So again, very curious. We get to the heyday of the proton pump inhibitor use. And then, I'm sure that the PPI makers started to feel the heat and feel the questions coming in about side effects of PPI and the potential for SIBO. SIBO kind of started coming onto the scene around this time, much more so in the mainstream. I don't know. I find that real fishy. But continuing on, minus the, that was all my conspiracy theory stuff, I think, for now. This is a 2018 paper. So this was the same year as the 3rd meta-analysis. I just wanted to point out here that the prevalence of SIBO was significantly higher in proton pump inhibitor therapy compared to controls. So 44.8% of people who use PPI versus 21% of controls. Now, I find it suspicious that 21% of controls had SIBO according to their testing. But if you look up here, where'd it go? They set up here somewhere that they're using glucose breath test. So, oh yeah, here. So underwent glucose H2 CH4 breath test. So it could be that they're overdiagnosing. They're getting false positives out of that. But nonetheless, even with a breath test, even with a glucose breath test, they were still finding a significant difference between the two. They also went on to say that even those on proton pump inhibitors who did not meet criteria for breath test positivity had statistically higher breath hydrogen levels compared to controls. So the people who were on PPIs and they were negative for SIBO still produced more hydrogen, although it would be subclinical. They still produced a significant amount more hydrogen than the healthy controls in their study. So they were closer to having SIBO than the controls, even though they were negative. So fascinating. We continue on. I just have a few more. Let me know in the comments, do you guys like these nerdy videos where I show you a handful of research articles and talk about the pros and cons? I never quite know. I know the clinicians amongst you probably dig it, but I don't ever know if normal people do. So let me know. I enjoy this style of video, but I want to make sure you guys do too. This was a really cool study. So duodenal bacterial load, this is the duodenum or the duodenum, depending on how you learn to pronounce it, is the first part of the small intestine. So as soon as the food exits the stomach, it goes to the duodenum. Duodenal bacterial load as determined by qPCR in asymptomatic controls, functional GI disorders, and inflammatory bowel disease. Really neat paper. So they took 237 people and they collected samples. So they basically did an aspirate of the bacteria in the duodenum, and then they cultured it and they did the 16S and the whole kit and caboodle. What was interesting is they did say that, let's see, And again, I have cheater notes on my other screen, so I'm just going to read that. I'm not going to highlight like I was a minute ago. They said, while patients treated with proton pump inhibitors had significantly higher bacterial loads than non-users, this did not explain the difference between patient groups and controls. But later on, what they elaborated on is they said, when PPI users were excluded from the analysis, the bacterial load of functional GI disorder patients, like IBS, patients remained significantly higher compared to IBD patients and controls. So that's what they mean is like, yes, PPI users had higher bacterial loads in the duodenum compared to controls. It didn't completely explain the differences that they saw between the functional GI disorders and the healthy controls. So it's a piece of it, but it's not the entire pie. So that's kind of what they're getting at saying that. But what I found really interesting, and I don't think it's on this page, I think it was in the article itself that I copied this from, they said PPI users had 4 times the odds of a positive methane breath test. So that's juicy. And it really makes you wonder if everybody with methane dominant SIBO should be taking betaine HCl or doing things to bolster their stomach acid. Now, I know some of you are like, oh my God, Pimentel said not to take that. It has hydrogen. Hydrogen feeds methane. I did a whole video on that, so check that out. I always say I'm going to link it and then I forget to do it. So I will try to remember, but I make no guarantees. If not, just type in the words betaine on this channel, like search in YouTube and you'll be able to find it. But I already did a whole video on that. It is a hogwash, ludicrous statement to make that statement. I think that it's still perfectly safe and advisable to do that, even if you have methane. All right, couple more papers, winding down. This is very new. Effects of proton pump inhibitors on small bowel and stool microbiomes. And you'll notice again, our boy, Mark Pimentel, coming back. So this is part of the Reimagine study. So they're doing aspirates and they're comparing this amongst people. But what was interesting is they said that PPI users had demonstrated significantly higher relative abundance of families. I'm not going to try to pronounce it, but it's basically Campylobacter's family. So Campylobacter is the bacteria that causes food poisoning a lot of the time. So 3-fold increase in Campylobacter and Bifidobacterium. That was very interesting. And lower relative abundance of Clostridia. Fascinating. They said that the stool microbiome exhibited significantly higher abundance of Streptococci, so Streptococcus, and lower Clostridia versus non-PPI subjects. So they said that these findings suggest that PPI use is not associated with higher rates of SIBO, but they certainly demonstrated dysbiosis in the small bowel and dysbiosis in the stool samples. And again, I pause and I want to point out this statement that PPI use is not associated with SIBO. You have to take that with a really big grain of salt because again, this research group is using, you guessed it, 10 to the third CFU per ml. And that is just a ridiculously low cutoff point. You're overdiagnosing SIBO here and you're going to screw up all of your data. So, take the PPI statement with a grain of salt, but they did show that PPI users had dysbiosis in the small bowel and dysbiosis as shown on stool testing. And I think that that is important for us to know. And I think that that starts painting a picture that we can work with. Now, these are the fun articles that I saved for last. So we've got some cool studies and I've shared these on the channel before, but it's been a little while. So here's one. Is it useful to administer probiotics together with PPIs in children with reflux? And what they did, they had a group of children that they put on PPIs, and they had a group of children who were put on PPIs and probiotics. And I believe they had a control group where they did nothing. They didn't take the PPIs, they didn't take the probiotics, they took nothing. And they said after 12 weeks of treatment, dysbiosis was detected in 56% of children from placebo, compared with 6.2% of children in the probiotic group. So they had the placebo versus the probiotic, I guess. Bacterial overgrowth was detected in 5% of controls. Probiotics had a lower prevalence of dysbiosis, similar to controls. If I remember this study correctly, let's see. Number of patients with positive glucose test. This was before treatment. So 6 controls had SIBO prior to doing anything. Interesting. And nobody in the placebo group and nobody in the probiotic group had SIBO. So I was right. They did have three groups here. Then, and this is not to scale with the other picture. Number of SIBO positive patients after the treatment, 6 controls still had SIBO, so it's the same as before. But look at this, the placebo study group shot up. 36 of the 64 kids developed SIBO from 12 weeks of PPI use. Holy macaroni. But look, the kids who took the probiotic with the PPI, only 4 of them developed SIBO. Pretty dang good, right? So I think that this not only shows us that, yeah, PPIs can cause SIBO, but it also shows us that probiotics can help with that problem. Similarly, number of symptomatic SIBO positive patients, 0 of the people with SIBO in the beginning of the study had symptoms, which makes you think that those were probably false positives, and that's an artifact from false positives and false negatives from SIBO breath testing and how much it sucks. 23 out of the 36 kids who developed SIBO in the placebo group ended up becoming symptomatic of SIBO. So that's a pretty big deal. 23 of those kids ended up developing the symptoms of SIBO. So that sounds like those are accurate diagnoses. And then look, out of the 4 children who developed SIBO from the PPI plus probiotic group, none of them were symptomatic for SIBO. So pretty freaking cool stuff. This is one of my favorite studies. I think it was really well designed and like really good quality questioning that they had here. Similarly, and I think these are different groups. Yes, they are. Similar kind of situation. They said risk of small intestinal bacterial overgrowth in patients receiving PPIs versus PPIs plus Prokinetics. Now, for those of you who have been around for a while or you've listened to me on the podcast, I freaking love Prokinetics. They are one of my favorite tools. I give them out like candy. They're fantastic. I'm going to come out with an updated version of my best Prokinetic video, hopefully in the near future. So I'm excited about that because the numbers have shifted a little bit. But I love Prokinetics. I think they're the bee's knees. And similarly, if you look at this study, they said they enrolled patients and divided them into 2 groups. Patients taking PPIs for more than 3 months and those taking PPIs with Prokinetics for more than 3 months. And then they did a lactulose breath test. So keep in mind that lactulose is not very good at diagnosing SIBO. I could do a video on it if you guys want. It's pretty depressing, but lactulose is hot garbage. But you'll notice they did a lactulose breath test for OCTT, that's oral cecal transit time. So they were not using it as a diagnosis of SIBO. They were looking at it to assess transit time, which is very well designed, in my opinion, that they did that. And then they used a glucose breath test for SIBO detection after they did the oral cecal transit time study. Anyway, that's another topic for another day. Of the 147 enrolled patients, SIBO was detected in 13% of patients in Group A versus 1.8% in Group B. That is a pretty big deal. So if you were to take a PPI, 13% actually isn't terrible considering the numbers from that last study. What was it? After... 56% of people from the study. So that's a much bigger difference, but 13.2, like it's a non-zero number for sure. in this group who got the placebo, but only 1.8% of people in the prokinetic group developed SIBO. That's pretty stinking cool. So if you think about it, if you had to take a PPI for whatever reason, if you could take that PPI with a prokinetic like motility activator and a probiotic of note, the one that they used here, this is the probiotic found in BioGaia gastris. If you could take the PPI with those two things while you sort out the reason for your reflux, I think that that would greatly reduce your odds of getting SIBO. So, you know, definitive conclusions in conclusion for this video, because I know it dragged on. I really think we have enough evidence at this point that we can definitively say that PPIs have the ability to cause SIBO. We've shown that it causes small bowel dysbiosis. We have seen that it increases the number of bacteria in the small bowel. It drastically increases the number of bacteria in the stomach. It causes dysbiosis in the colon, not to mention the numerous nutritional deficiencies that you can get when you take PPIs because it mucks with their absorption. These are just bad news bears drugs, but they are incredibly lucrative moneymakers and they are pumped out like candy. And it's going to take time for medical providers to realize how dangerous they are and stop prescribing them so much. To be clear, I don't think that these are a never, never, never drug. I think that they are just horribly overprescribed and they need to be used like 1/100th as frequently as they are currently used. Keep in mind, I'm not a prescriber, so maybe take that with a grain of salt, but from my observation at least. But I think that we have shown in this video that PPIs can cause SIBO. They seem to do so pretty frequently. But thankfully, if you could take a probiotic or a prokinetic, that should help correct some of the dysbiosis or motility problems that result from the PPI. And of course, if you could get off of the PPI safely and effectively, and if you can do things to bolster and improve your stomach acid, I think that that will go a long way in treating SIBO if you do have SIBO. So that's my take on it. I really think that it's a pretty clear slam dunk to me, but I think that there are groups that are using inappropriate cutoff ranges to diagnose SIBO. And I think that there is maybe some industry push to try to make these drugs look safer and more effective than they actually are. But again, that last part maybe is a little bit of a conspiracy theory, so I'll just leave it at that. Now, for those of you guys who don't know, I have all sorts of wicked cool ideas for things to do on this YouTube channel. Lots of poop tests, side-by-side comparisons, exposés. I'm going to make a bad name for myself amongst my profession, and I'm going to get banned from all these lab companies if I keep this up, but that's okay. I think it's a necessary effort here. And I have a lot of ideas, but I'm paying for these on my own. I could do that to a certain extent, but after a certain point, I might need a little bit of help. So at the suggestion of one of my wonderful viewers, I created a Patreon. No pressure. If you want to just keep watching on YouTube, that's fine. But for those of you who are able to, or if you just want to say thank you for the videos that I do, or if you want to help fund my crazy mad scientist experiments and my poop tests, it would be so deeply appreciated. So check it out. The link is down below in the description. We've got a couple tiers. We've got just the thank you tier, the Discord tier, and then the monthly Q&A tier. So check it out. I think I have something for everybody. And as always, I will see you in the next video. And I hope I keep bringing the truth to some of these controversial topics so that you can weed through the bullshit and just feel better. Because that's what it's about at the end of the day. Right? You just want to know, what should you be paying attention to? What do you get to just shrug off? And what is actually going to be effective and get you feeling better? So I hope that I can help you with that, and I will see you in the next video. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.